Mark Perry of the American Enterprise Institute has updated a version of his popular chart that shows the divergence in prices of consumer goods over the course of the last 20 years. You can see here, these are price changes from January 2000 to June 2022. The reason this chart is popular is because it taps into, I think, something people sense just inherently as they go about their lives. These major price hikes are on essential services for the most part: hospital, college textbooks, medical care, childcare, and food and beverage, housing, average hourly raises or average hourly wages. These are things that have gotten more expensive over time, whereas things that have gotten less expensive over time include cars, household furnishings, clothing, cell phone services, computer software, toys, and TVs. All right, Ryan, this is populism in a chart, I think, because you can talk about trade, you can talk about protectionism, you can talk about subsidies, you can talk about all of these different things. You can talk about government inaction, and that's not to say this breaks down totally neatly, like for instance, wages going up and food and beverages going up, and whether or not college is essential is an open debate, but Elite certainly has presented it as something that is. But when you have things like hospital services, medical services, childcare, housing all going up, while the things that go down are TVs and toys, I think that's a statement on where we've gone over the last 2 decades. Do you agree?
Yes, and speaking of populism, looking at this chart here, if you notice, a lot of the things that have declined in price are manufacturing, are the products of manufacturing. And so, if you look at toys, TVs, software, clothing, cars, these are all things that since the 70s, but accelerating in the 80s, 90s, feeding into this chart, were things that were offshored.
Yes, and that's interesting because wages
lower labor. Yeah.
Yeah, that's interesting because average hourly wages have increased as well. But if your hospital services and medical care services are going up as well, then those wages are less. You feel the increase there less.
Right, the real wages, haven't gone up because they're getting sucked into those things, those charts that are above it, and I think that college and food are like the great example that everybody, I think, who's lived through this time can understand. In the early 2000s, if you went to Wendy's, it was 99 cents for chicken nuggets. You go to Wendy's now, it's slightly more, but up until pretty recently, 99 cents for chicken nuggets, like barely any change. Like, and that Taco Bell, McDonald's, like like all of these places, their value meals, whatever. Stunningly, time would go on and they would stay at precisely the same rate. Yet the price of college over that exact same amount of time, doubled, tripled, quadrupled, like just absolutely extraordinary explosion of costs. And then when you throw on top of that, the medical expenses that are put in here, childcare expenses and the others, these essentials are really draining people, while hourly wages are going up by just a hair and not at all keeping up with that. And then we mollify people by saying, well, yeah, but look, you can get a cheaper TV, and we're keeping the price of food down.
Exactly.
In this chart,
food technically has gone up, but less than the other increases.
Right, and he highlights the things that government subsidizes, but actually, the government subsidizes average hourly wages by giving corporate welfare and covering Medicaid for Walmart, and government also subsidizes food and beverage, like the Farm Bill and other mechanisms. Like it costs a lot more than $5 to get one of those broilers.
Well, I was just going to say,
the grocery store and back home to you.
Well, yeah, I was just going to say, so John Arnold did a modification of this graph, which I don't know if we have the picture up for the screen, where he said he highlighted items that were highly subsidized by the government. But that's I think that's a pretty subjective measure. And I did want to get your take on that, Ryan, because I have a hard time seeing how, for instance, new cars. We've seen subsidies in that industry, certainly to keep jobs here in the States. I would imagine computer software, I guess it depends on how you're defining it. At least recently, there was just the CHIPS legislation that we talked about earlier in the show that is a big subsidy to, and I guess if they're talking about the software itself, that's a different question than the computer itself. But there are definitely subsidies that affect directly or significantly indirectly these various industries. So what do you make of the argument that prices have gone up for very, very subsidized industries like hospitals? I mean, these places that have gone up have some of the biggest lobbying presences in Washington, D.C. When you talk about medical care and services, and when you talk about education, they have big lobbying presences.
Right.
So, but do you see this as an argument that subsidies can end up hiking prices and hurting the quality of the care?
I don't, because subsidies go both ways. So everything on there is subsidized. Like the idea that the U.S., as a matter of policy, offshoring all of its manufacturing and then bringing those goods back at a cheaper price, by subsidizing a global trade environment that enables that to happen, that's not a subsidy doesn't make any sense. Like that is a subsidy. It's a subsidy in order to mollify working people so that they'll continue losing ground when it comes to wages and not get too frustrated. I think the other pieces that you're seeing, I think education is separate, and I think we largely agree on a lot of the price driving problems on that. But on healthcare, we're talking austerity, disinvestment, and corporate concentration there. We're allowing all of these different hospitals to be bought up by one or two companies. We're not building new hospitals. We're not investing in public competition against these private hospitals, and so then you're creating these complicated private insurance middlemen, and then we're surprised when they just relentlessly jack up prices. So I think it does show a complete breakdown of the market, but also a complete breakdown of government investment in healthcare at the same time.
Right. It shows complete capture, I think, by lobbying forces in some of these various industries, which is where it gets frustrating, especially with some of these bills that just passed this week. The climate bill, for instance, I haven't looked through it. I don't know if the text is public yet, but I guarantee you there's crony capitalism in it, and it happens time and again. And that's not to say it's avoidable. I support industrial policies, in particular industries myself, even though you run the risk of cronyism. And I mean, you run a very strong risk of cronyism. Sometimes it has to be done in order to provide basic services, whether it's national security or medical care for your constituents. But in this case, I think it does add a good bit of nuance to this idea that government funding is an easy Band-Aid. It's an easy Band-Aid for lawmakers because it's payouts to their backers that a lot of times aren't actually crafted in ways that is going to fundamentally get at the heart of the problem. Education is a pretty good example of that. I think medical care is a really good example of that too, and it's why you and I can talk to Matt Stoller, and all three of us are probably going to find a lot of agreement on this because it's crony capitalism and monopolies that have made so many of these services, fueled by lawmakers here in Washington, that have made so many of these services just absolutely unaffordable.
Yeah, there are some real kind of conservative underpinnings of the kind of anti-monopoly approach and ideology. So for sure, that's definitely a place where you're going to find some allegiance across the spectrum. Interesting chart. It's like a chart of the wheels coming off, basically.
Yeah, that's a great way to say it. A tragically great way to say it, but it's worth a look if anyone has a chance. But we will be back with more Rising right after this.